Roll, okay? All right, hi, Dr. Nikita Vizniak here with the amazing super therapist,
Chelsea.
And today we're going to go through some exercises that you might choose to use for your low back pain clients and for yourself if you're suffering from low back pain. Both of us treat a number of patients on a regular basis with low back pain, and we have found these exercises to be absolutely fantastic for them. So, for most people, they usually feel best laying down on their back with their knees bent. And this is usually a good starting point. There are some times when you might not have to do this. But both of us are going to move, and you'll see how our variations in movement are a little bit different. So I'll get Chelsea a little bit closer right here. There is no perfect way to do any of these movements. What you're trying to do is just get your back moving, period. If you look at the research, it's pretty clear when people hurt their low backs, the first thing they do is stop moving. And what we're trying to do is break that cycle as soon and safely as possible. So, to start, usually what I'll wind up doing is having my patients lay down like this, just nice and flat. And most people feel pretty good just laying flat. And here, even just breathing is enough to start to move your spine. Never mind if you have anxiety and a lot of negative thoughts around this back injury and what it means for work and family interactions and everything else. Go ahead and just start off with some simple breathing. And the goal here is not to be a heavy chest breather, because then it doesn't put much of the movement into your low back. Your goal is to actually take your abdomen and see it expand as you breathe lower into your body. So when you inhale, you can see the abdomen expands, it kind of rocks your back a little bit flatter. And then when you exhale, everything thins out a little bit more. So inhaling, exhaling. So we're inhaling through our mouth, inhaling through our nose, exhaling through our mouth. So you want to actually hear that breath. Exhaling. And even this helps put you into a more relaxed parasympathetic state, so a great place to start right here. If I could just get more people to breathe better, we'd find the world to be a better place. We've got our shoes off here as well, so it helps you ground in a little bit better, so the simple breathing can be there. And once you've found yourself centered and more relaxed in a position like this, then we can progress into some micro movements to just challenge the area. And it actually doesn't matter if it's acute pain or chronic. If you can challenge your boundaries a little bit, you'll see better outcomes with it. So if I inhale, then I exhale, you can start to do what we call pelvic tilts. And all I'm doing is taking my pelvis and rocking it posterior just a little bit. I'm not lifting anything up, I'm just exploring the range to see how I move. And then you can rock your pelvis anterior, so you really start to lift up and arch through your back. Again, to whatever your tolerance and normal range of motion is. We're just rocking back and forth, exploring that range. You can do it with breath if you want. You could almost look at these like supine cat-cows if you wanted to as well. So when you're breathing in, you're doing an anterior pelvic tilt. And then when you're breathing out, you're going in the opposite direction. Even the breathing, it doesn't matter which direction you're moving, just breathe and explore the range. If you find yourself feeling sharp pain, go to that border, challenge it, and then move away from it. Go to that border, challenge it, and then move away from it. And you'll be surprised how quickly you can restore your normal range. The next day you try this, you might be able to move just a little bit, 10%, 20% further. Those small victories are big wins in rehabbing a low back. Okay? All right, next movements can be side-to-side tilts. So I'll lay on my side so you can see it, but ultimately I'm lifting my hips up and bringing my hips down to the side like this. Realistically though, that might be a bit too much to start if you're really acute, so just a little side-to-side movements, and you're going to find that you have a little bit of a bias one way or another. Again, challenge those areas where you feel a little bit of sharper, more discomfort, and then move more freely into the areas where you feel like you're moving well. Still working with your breath. Side-to-side tilts. Again, you need to visualize anatomically, what am I doing? I'm taking my vertebrae, I'm taking all my muscles and moving them from side to side. I'm actually stimulating local nerves, moving blood in that area, decreasing sensitization of the tissue potentially here as well. All right, so everything's okay there. We're going to stay fairly linear with our next progression. So here you can do a posterior pelvic tilt and then just start to lift your hips off the mat a little bit and then slowly bring them back down. If you're doing this at home, I would encourage you to have a yoga mat or do it on a rug or somewhere softer. It tends to be a little bit hard on hard floor surfaces. And then same thing again, posterior tilts, lifting yourself up. Always challenging borders how far you can move. Dropping yourself back down. If it's there for you, you can go ahead and lift your hips up just a little bit and then lift your lumbar spine off a little bit so you get a little bit higher and then slowly bringing yourself back down. If you're still wanting a little bit more challenge, lifting up the hips, lifting up the lumbar spine, and a little bit further, lifting up so you get off onto your upper thoracic spine as well. If this is too much, don't force yourself into it. Again, joyful discomfort is what we're looking for here at the most. So a little bit of joy as you're moving through. Always focusing on breath, and you can always come back to just supine, laying down with your knees bent, and then back to your regular breathing. Sometimes it's good to challenge and then come back to regular movements. Now, one of my favorites to give people, when you look at a lot of low back injuries, they happen from a lifting, twisting event. We're going to call it windshield wipers, or your knees are like windshield wipers. You're going to drop them down to one side, and you're going to have a bias. One movement that feels better, so dropping down to my left feels okay, coming back up, and then dropping down to my right. Oh, sharp pain right there. Again, find that border, stop, and bring yourself back. The benefit of this movement is that your spine isn't compressed with gravity pushing down and loading, and you can take and stretch out your low back, and you're actually working your abdominal muscles in a rotary motion at the same time. So actually improving strength right here. So I'm inhaling, exhaling as we roll through, and just simple movements from side to side. Especially getting down, dropping in, and then lengthening out all the way on one side. And again, your cycle can be as simple as 1 or 2 or as many as 5 or 6. But every time you're moving, you're both stretching and strengthening out your low back, your abdominal muscles, all of that. Chels, how are we doing? Fantastic. All right. So we can go ahead and roll from side to side there. Now if you want to add another layer to this, what you're going to wind up doing is back to that pelvic lifting. So you're going to go ahead, lift your pelvis, lift your low back all the way up. And if you feel like it's there, this will work on torsional strength. Bring one foot slightly more to the midline and extend the other leg out. This balancing from one side to the other gives good torsional strength through the abdominal muscles, helps your back actually develop better strength when you really have to move around in real life. And it's a great balance exercise too, just to be able to hold that position. You can bring that leg down, plant it, and then switch sides. Move to the opposite side and try and balance out your motions. Okay? So those movements there, you can move your leg around. If you get better at it, you can make figure eights with your legs, so you're trying to find different balances. If you're into jiu-jitsu, you're going to get used to reaching around with your leg and grabbing somebody with it. But for right now, good torsional movement to maintain balance there. All right. Super therapist Chels, is there anything else you like to do in a supine position like this? Oh yeah, that's good ones too. So if you want to focus more onto the hips and everything right there, she's giving us an excellent one. Even if you can just lift your leg up like that, that's a good starting point, okay? If you want to add a little bit more, you can reach and grab the lower leg, bring yourself up this way, and feel that lengthen in through your piriformis, your quadratus femoris, and the short lateral rotators in this direction here. Okay? If that's too much, just drop one leg down and bring your knees up to your chest. This action right here also gets you moving your low back again, rounding out your low back. Our patient just yesterday we were going through doing this. Lifting her up and then coming all the way up into here and then back down. And then you can bring both knees together if you want, and that can also lift up and in a nice safe way, round out the low back, start to get some motion in there that shouldn't result in significant injury or pain. Okay? And then we can slowly bring ourselves back down. All right, and I'm just going to balance out because I only did it on one side, so bring it up here. Same thing with the leg on the opposite side. Good, simple movements to challenge the lower body. Nice variations where you can straighten that leg out if you want. Yep, hamstring, and then dorsiflex those toes, bring them right up, take them all the way down the posterior kinetic chain in there. Fantastic. Good one, super therapist Chelsea. Anything else? Oh, give us a shoelace. Oh, the full crossover, yeah. Yep. Okay, so I'll roll this way. Yeah. Okay. It looks like you can't do this, but most people can get into this position right here. You get pretty tangled up, and then you can reverse the opposite way, and the same thing. Bring yourself around like that. Okay, this is focusing more on the lateral rotators around the hip, but still, it's an interesting new way to move your body, give you new stimulus in the area, and even bringing your knees up into this position as well. Okay? Nice. Shoelace pose. Super cool. Okay, that'll get you through some of the basics that you can go ahead and try out in a supine position. If you want, there's other variations we can do in a prone position as well. Take your time, be gentle with yourself when you're getting to these different movements, but a simple cat-cow can work wonders for people. Cat-cow's child's pose, okay? So, a couple of key things right here. We're going to start off and be nice and balanced. You want to have your shoulders over your elbows, over your wrists if you can, and you want to have your knees over top of your hips. And then from here, the movement is, again, gentle challenge, joyful discomfort. You can arch your back up and try and get it as round as you can, and let your head drop down. And the dropping of your head is actually quite important. Probably rubbing the mic here a little bit. The dropping of your head is quite important because it actually allows you to stretch out your neck. And then we're going to reverse the opposite way. So you're going to arch your back down, breathing in, looking up. And this movement right here, we'll take it off of Chelsea because she'll cycle through it a couple of times. So go ahead and cycle down again. The real goal here is the muscles that run all the way from your sacrum, run all the way up through here, the erector spinae, and are also being lengthened and challenged when you do this action. Okay, go again for us, Chelsea. You can see she's got great motion in her lumbar spine, good movement through the thoracic and through the neck. This is a win for your entire spine. Now, in some acute cases, what I find is people have a tough time even doing cat-cows. I've had a couple of patients where they've had to sleep into what we call child's pose. So you can go ahead and drop yourself back onto your heels with your toes together and bring yourself down nice and low. And even here, you're just kind of rounding your back out, trying to find the right arch and right position where you feel just a little bit of stretch and challenge, just nice movement, being kind to that low back. Okay. Just those little movements back and forth, and you can see Chelsea gets further into it. I actually have a fairly significantly sprained ankle here from a couple weeks ago, so it's harder for me, but I'll get back into it soon enough. And again, even into these positions right here, focusing on your breath. Always good breathing. Move that spine around a little bit back and forth. All right, so now we're going to say that you've got these movements down, everything's okay there. If you want to add more to it, you can go ahead and do what I call spinal skipping. So you bring your spine to the side and pretend it's a jump rope, and you're going around in a circumduction motion or circular motion if you wanted to look at it that way. Yeah, I cue this sometimes in our yoga classes, but it's a tricky movement for people to get. That movement around, and then the same thing the opposite way. So you want to try and coordinate both movements. Your spine is actually quite a complex area of the body, and it takes a lot to coordinate those movements. And believe it or not, you're looking at a back right here in me that has multiple disc herniations, sprain strain events, and all of that, and we can maintain a relatively good function there. All right, Chelsea, anything else you want to add into this prone ones that you do?
There's the one, it's more so for like the shoulders, but it's thread the needle.
Oh yeah, totally. That's a good one too because it actually adds a twist. Now, commonly what you'll see is more rehab people will do this. We'll do thread the needle first. So, why don't you take us through it?
And then kind of put all your weight into your left hip. And then if you want, you can bring your right arm overhead.
Yep. And so everybody's going to feel these a little bit different. For me, I feel it mainly in my low back and a little bit through this lat. Where do you feel it?
I feel it in my shoulder that I'm stretching, and then I can feel it, going up into my shoulder there too. Mm-hmm.
And it's a relatively safe position to get into a spinal twist if you want to, okay? It's a relatively easy one here. And then we can reverse it. You always got to balance out whenever you can, so same thing opposite way. Usually when we get into it, I'll cue starting twisting one way and then bringing yourself across and coming in the opposite way. Walking your hand up, giving your partner a high five at the same time. So just try them out, see what works for you. Often the more challenging ones are something that you should spend more time trying to get into a little bit more too. All right, so we can come out of this. You can go back on all fours. If you want to work on the torsional stability in your low back, the other thing you can do is go ahead and just put one arm up. And it may seem simple at first, but raising that one arm is enough to actually have to make you balance your upper body and lower body through your low back. Okay? And if you want, that arm can swing out to the side, come back up through the center. So you get used to those shoulder movements as part of your spinal stability. You can go ahead and switch hands, so find the opposite hand. Other arm comes out. Same thing, moving through some range. If you got a partner to work with, put your hands up and go, what's up, bro? One of those. Okay, back and forth. Or you can go with legs as well. So taking one leg, shooting it straight back. Yeah, and these will be challenging. We'll see what else can do here. Nice, okay. So that leg's gonna come back, and you can just hang out like this, or go ahead and bring that leg out to the side. Back to center. And even this, it seems easy, but you can see that you'd be struggling with your low back to maintain balance and all that.
My hips like to turn
yeah.
when I do it, so just make sure your hips aren't going out like that.
Or the big twist square, up. Yeah. It's better that you do the movement than not do the movement, but ultimately we're looking for good stability through it as we do it. Good control in our alignment, okay? You can go ahead and switch legs, so opposite leg comes out, and then same thing, just moving from side to side. And Chelsea's young. She's only like 22 here. I'm almost 50, and we're doing this right here. So it doesn't matter the age. Try and work your way through. And if you want to add more to it, you can go ahead and plant one knee, lift up the foot, and then the contralateral or opposite arm and lift up, and look for that balance as well. And then the same thing. Arm and leg can come out to the side if you want. Switching sides. Now, I'm going to switch sides here again. So, I'll be like that. And you can see that I'm taller than Chelsea, so I'll just put my hand right over top of hers. Shazam! Okay? So those movements right there. The important thing is consistency and that you try and do them and gradually increase your level of challenge. Anything else you want to add, Chelsea?
No, I like doing it.
Yeah, that's super good, right? Okay, well, thank you very much for your time, and hopefully you found this useful. We'll see you in our clinics or at a video somewhere in the future, and bye-bye for now. Okay.